If you remember in August, we went through the MECQ and there was a surge, di ba? So since then, the pandemic has kept going down and the R has been good. But this past weekend, the R, especially in the NCR, has gone up above 1 for the first time in many months. And so technically, by definition, the wave has begun. And so the question now is, how high is the wave and how fast is the wave? And that's the concern that OCTA has. We see the wave coming and we want to keep the wave down and the wave slow. For us, it will be a third wave. So we had the initial wave sa March, and then June and July was second time, and this will be number 3. What we have done is we have looked, every day the R could go up above 1, but here we are looking at a trend. And we have seen that the R has been increasing by 0.01 per day since the beginning of December. So it's just slowly going up, and it has now passed 1. And because of the increasing mobility since October, really. So the lowest R was about 0.6 in October, and then rightfully so, as we began to open the economy to help people to recover their lives and their livelihoods, not surprisingly, the R has kept going up, but it has been under control. But now it has gone above 1 for the first time in many months. Can we have tens of thousands of cases here? Absolutely. In August, in June and July, the end of July, we were having 4,000 cases on average in the Philippines, 2,000 per day here in Manila, in the NCR. Can we have that again? Yes. But in OCTA, our hope and our goal is to prevent that from happening, because we do not want to see another lockdown. There are places in the world that have gone back into lockdown. I hope the Philippines will do, and this is OCTA's position, is that after Christmas and after the New Year, we start to limit some of the mobility to decrease the R. And we do not have to go into lockdown. That is always the last measure. That is always the most extreme public health measure that we can do. And we can avoid that as long as we keep the numbers moderate. And most of the data shows that it's associated with mobility. So if the mobility is what is driving our rise, then we have to consider rolling back some of the mobility openings in order to prevent a lockdown.